Good morning, and thank you all for joining. Good morning, and thank you all for joining. We'll be starting our live broadcast momentarily. All right. Good morning, and thank you all for joining us today. My name is Devin Miner. I'm a state network manager with National Skills Coalition. And on behalf of the Skills for California Network, I want to thank you all for joining our live broadcast, Notes from the Field, where we'll be focusing on COVID-19's impact on California workers. As a piece of background, the Skills for California Network is consulted by 16 leading workforce development organizations across the state and is led both by the California EDGE Coalition and National Skills Coalition. With the guiding principles of equity, pathways to good jobs, and systems innovation, our mission is to advance workforce development policies that remove systemic barriers and promote an inclusive economy for all Californians. I'd like to thank our funders at Balmer Group, the James Irvine Foundation, and Tipping Point Community for making this work possible. And you all can learn more about our network and sign up for our email list by visiting our website at www.skillsforca.org, and that's for FOR. As we start today's broadcast, I want to encourage you all as experts to engage with us using the chat box. To the right of your screen, you'll find a chat box where you'll be able to kind of share your questions and reactions. Towards the end of this broadcast, we'll get to as many questions as possible during our Q&A segment. I also want to let everyone know that today's broadcast is being recorded and will be shared at a later date along with additional resources. Today's broadcast will feature a live, moderated discussion with me and my colleagues Zima Creason, the Executive Director at California EDGE Coalition, and Brooke Dorenzis, Managing Director of State Strategies at National Skills Coalition. Today's broadcast will also feature a series of recorded videos from leading experts in the field, including Lisa Countryman-Quiris, CEO at JVS San Francisco, Corinne Eldridge, President and CEO at the California Long-Term Care Education Center, Maria Marino, a community organizer at Restaurant Opportunity Center Bay Area, or also known as Rock the Bay, Xiomara Pena, the California Program Director and National Latino Entrepreneurship Director at Small Business Majority. We'll also hear from Luis Sandoval, Executive Director at Building Skills Partnership. And lastly, we'll hear from Aveen Sharma, Director of Labor Relations and Workforce Development at the Port of Los Angeles. As we kick off the conversation, I think it's important to acknowledge that COVID-19 will have and continues to have an unprecedented emotional and economic imprint on California communities and economy. The pandemic is exacerbating existing inequities rooted in policies and systems that have systemically limited economic opportunity for people of color, particularly Black and the Latinx community, immigrants, and other historically marginalized people. As we begin to think about what an equitable and inclusive recovery should look like, it's important to know that a skilled and diverse workforce is key. Workforce solutions should be linked to good, high-road jobs and specifically reflect the economic and career aspirations of California's most vulnerable workers and historically marginalized. With that, let me turn to my colleague, Zima. Zima, in your opinion, how would you describe the impact of COVID-19, both in general and within the context of the workforce development arena?
Hi, Devin. Thanks for that. You know, COVID-19 turned the world upside down. It disrupted the day-to-day predictability for people, businesses, agencies, educational institutions, and we're talking about around the world, not just here in the US. Workplaces, employers, employees, students are experiencing tremendous hardship due to the pandemic, and the impact's going to be long-lasting, and we really must position now so that we can lead in responsive recovery.
Thanks for that, Zima. And as you all may recall in our registration, we asked you all how the pandemic has impacted you and your work. And I want to share some insights here. So one thing, a lot of you mentioned that there was a shift to remote schedules and a lot of virtual engagements for your clients. Cataline De Soma from the San Joaquin County Office of Education shared how the pandemic has had a financial impact on the youth in their community. A lot of them were pulled from their work sites and expressed that they can no longer contribute to their low-income households. Another participant, Jeannie Mish, a CTE counselor at Cypress College, mentioned how they were working to serve their college students now that everyone is remote, and how students who were once hard to reach are now even harder to reach. Adria Salvatore from the Association of Woodworking and Furnishing Suppliers mentioned how they are working to support their partner manufacturing companies and how a lot of them are also uncertain about what the future entails. So I want to thank all you all on this broadcast for submitting your responses. We'll keep a close eye on them as we continue to work in Skills for California. Now, as we direct our attention to our first video, we will highlight our partner, Aveen, one of our partners at the Port of Los Angeles, who captures how both the port and many of their frontline employees were impacted by this national crisis. Here, Aveen will share and describe how they navigated the initial panic and scare of the pandemic while also keeping the safety of their workers at the forefront of their efforts.
Hi, my name is Aveen Sharma. I'm the Director of Labor Relations and Workforce Development here at the Port of Los Angeles. The Port of Los Angeles is the busiest container port in the United States and actually throughout the Western Hemisphere. So we've had a few different unique perspectives in how the Port of Los Angeles has dealt with the COVID-19 pandemic. We have the largest concentration of longshore workers, approximately 15,000, the longest concentration in the country, and we have tens of thousands of trucks and truck drivers that come through our gates every single day. Our initial impact for our frontline workers was really felt towards the end of January, February, when factories in China weren't reopening after the Chinese New Year holiday, but stayed closed because of the COVID-19 impact there. We had a reduction in the amount of cargo that was coming here to Los Angeles. And so that impacted the number of job opportunities for our longshore workforce and our truck drivers. And so what we did is worked with the longshore workforce, the terminal operators, and try to give them as much data as we had on visibility for ships to help better scheduling for the workforce. In addition to a reduction in workforce, we were also working with our workforce stakeholders and partners on making sure they had the necessary equipment and supplies to provide a clean and safe work environment. So we did receive some donations from some generous businesses in the community, so we were able to get some goods out immediately to our trucking community and our longshore workforce. And we also tried to step up here internally. So by way of example, we were contacted by the Longshore Union and the employers asking for some help obtaining cleaning solution. We were having the same challenges as everyone else through traditional vendor channels. And so one of our officials here at the port reached out to the LA Department of Water and Power, and LA Department of Water and Power provided us with 700 gallons of industrial bleach solution. We took that bleach solution, brought it back here at the Harbor Department, and our own Harbor Department staff here diluted it down to CDC approved levels, and our port leadership spent the weekend driving around to various Home Depots and stores here in Southern California to purchase bottles themselves, and we were then able to bottle it. Here's actually what one of the bottles looks like. So it's a cleaning solution that we made in-house here at the port that we then shared with all the terminals at the port, so that way they're able to provide it to those that are cleaning the equipment. As you can imagine, there are tens of thousands of pieces of unique equipment, whether it's cranes or forklifts here at the port. So that was a big help. Our focus right now is to also help with hospitals and first responders and expediting any shipments they have that come through our port to make sure they get straight to the necessary hospitals and first responders. And what we'd also like to do to help the frontline workforce here is we're looking at coming up with ways to make sure that there are channels of vendor supplies to, whether it's longshore workforce or other supply chain workers, to make sure that the companies where they work have the needed cleaning equipment and other safety gear that they may need to ensure a safe workplace. So those have been some of the different examples of how COVID-19 has affected the Port of Los Angeles and our frontline staff and frontline workforce here. Thank you very much.
Thank you, Aveen. And thank you for submitting that powerful video. I want to remind everyone who wasn't here at the beginning to use that chat box to submit your questions and share your reactions to what's being shared today. So going back to Aveen's video, I think it's important to note and elevate how Aveen and the Port of LA worked with management and the union to shift the shoremen and drivers' work schedules to respond to changed forecasts and shipments, along with producing and dispatching their cleaning equipment. And additionally, and looking to Brooke here, Aveen's story does an interesting job of illuminating the impact of COVID-19 on both individual workers and businesses as it relates to the delivery of goods and services. And I want to focus on the latter here. And so this question is for you, Brooke. How have small businesses been impacted, and what does this mean for their workers?
Great. Thanks so much, Devin, and hi to everyone. Thanks for tuning in. Over the past 2 months, many small businesses have had to close or otherwise reconfigure their businesses in response to stay-at-home orders. And many small business owners have had to make difficult choices that affect their own livelihoods as well as those of their workers. This includes decisions about layoffs, furloughs, and reduced hours. As we're going to hear next in the broadcast, small businesses create 2 out of 3 jobs in the state of California, meaning that COVID-19's impact on California's small businesses extends beyond the businesses themselves to employees, their families, and their communities. In the immediate term, policymakers can provide support to small businesses to help them avert layoffs, reopen, and bring back their workforce. They can also make sure that small businesses in impacted industries have the solutions and tools they need to adjust their business models and train their workforce to adapt to a post-COVID-19 reality. In terms of workforce development, we should be looking for opportunities for small businesses to partner with the public sector and workers on upskilling initiatives and training as part of rapid rehiring efforts. And to have an inclusive recovery, we need to be intentional about making sure that all small businesses, including those owned by people of color, women, and immigrants, have access to recovery resources and tools as they've developed.
Thanks for that, Brooke. And as she mentioned, we were able to connect with our partners at Small Business Majority on this matter as well. So I now want to turn to Ziamar Pena, who will share some key data points from a survey that they recently conducted with small businesses.
Hi, good morning. My name is Xiomara Peña, and I'm the California Program Director for Small Business Majority. We're a national nonprofit that actively seeks to engage small business owners and policymakers in support of public policy solutions. We also work to deliver information and resources to entrepreneurs that promote small business growth and drive a strong, sustainable, job-creating economy. As the pandemic continues to expand and governments respond, we've been focusing our educational content on the very core needs of small businesses during this crisis. We've had educational workshops around the resources that business owners need, around their workforce needs. We've also talked specifically around the financing solutions for business owners during this time. We have had a rapid response information sharing through our network. Many of you, I want to thank you all for being part of that network. We recognize that the scale of this pandemic is clear, and we've developed a series of webinars in English and Spanish. We also have many different partnerships with groups across the state to ensure that business owners in Central California, the Inland Empire, San Diego, the Bay, and others are not left behind. Want to recognize that our team has worked to create a one-stop hub, www.venturize.org, where small business owners can navigate access responsible capital and find local resources, their local technical assistance centers, which we plan to add workforce development organizations in the next month or so. We have conducted a poll, which was released on April 14th, specifically talking about how small business owners are working to address this crisis. What are their immediate needs? We polled about 500 business owners. An astounding 9 in 10 say that the coronavirus has significantly impacted their business, with 43% who say that it has had a severe negative impact. A whopping 1 in 3 small businesses have already closed. 4 in 10 have permanently laid off their employees. About 56% have furloughed their employees, and most, about 72%, have reduced hours, salary, or both for employees as a result of the crisis. About 53% said that the CARE Act and the $2 trillion stimulus package recently passed by Congress was a good first step to address the challenges that they're facing, but believe that more small business assistance is needed. Now, most small business owners, about 92%, indicated that what they needed from the federal government to help them survive this crisis is direct grant assistance, with about 66% strongly supporting direct cash grants to help ensure small businesses can recover. About 47% said that they have closed their business or are planning to close their business within the next 2 months. But encouragingly, 93% of these respondents say that they plan to reopen once the crisis is over. 54% of small employers who have made those reductions to their workforce are still offering healthcare coverage to laid off, furloughed employees. But about 68% of those business owners said that they were concerned about their employees' ability to access health insurance. We recognize that small businesses here in California, creating 2 out of every 3 jobs, are going to be significantly impacted. We recognize that there's a massive need for workforce training investments. We don't want our underrepresented small business populations, women-owned businesses, minority-owned businesses, Latino small businesses to be left behind. That is why our organization is continued to be committed to ensuring that we are partnering with our network of partners to ensure that these businesses are provided with the access points to the tools and resources they need to be able to thrive. Small Business Majority is continuing to push forward the policy agenda that small businesses need to be able to survive. We strongly are urging Congress to provide $250 billion in grants for small businesses so they can keep their businesses afloat. Now, with that, I hope that you all stay healthy and safe. I know that this is an unprecedented moment that we're all living and working through, and we can, as a community, build that ecosystem to ensure that Californians are supported, both workers as well as small businesses, with the tools, the resources, the assistance, the mechanisms that they need to make it through this global crisis.
I'd like to thank Xiomara for those timely insights. And as Brooke mentioned in her introductory remarks, and what Xiomara underscored, is that COVID-19's impact on small businesses also has a residual impact on frontline workers, of course. And I want to stay here with Brooke in this conversation. So, Brooke, how would you describe the current challenges faced by frontline workers? And what has the pandemic done to shift those conversations on their needs?
Thanks, Devin. I'm glad that we'll be hearing throughout the broadcast about the needs of frontline workers. And I think this pandemic has really underscored how California and in fact our entire country depend on working people. Yet people who are in jobs that don't require a bachelor's degree are being acutely impacted by the crisis. I know we'll be hearing from Maria from Rock the Bay about how there are lots of workers who have lost their jobs or had their hours cut because of how their industry was impacted by stay-at-home orders. Think of workers in retail, in restaurants and hospitality, and childcare. Many of workers that are in these heavily impacted industries earn lower wages and were already economically vulnerable. So there are things that California's policymakers can do immediately to ensure that these workers have access to income supports, including expanded federal unemployment insurance, as well as healthcare and retraining. California's policymakers can take steps to remove any barriers to safety net programs, including food, cash, childcare, and housing assistance that workers who might be living paycheck to paycheck desperately need right now. And the state can increase financial relief for immigrant workers who don't qualify for federal programs. As we think to the future in terms of workforce development, we can think about how we can make sure that displaced workers have the resources and the training they need to take the next step in their career, either in their current industry or to transition into a good job in a new industry. For example, California has a high road training partnership model, and there might be opportunities to think about how that could be used or expanded to serve workers and employers in responding to changing industry needs. One more thing I want to mention, in addition to addressing the needs of displaced workers, there are many workers who are still working in the frontline jobs to keep California running. And I know we'll be hearing about that as well during this broadcast. These are workers who are stocking grocery shelves, keeping our internet up and running, driving trucks, sanitizing buildings, and caring for patients. And I think it's important to underscore that these workers deserve our appreciation. They also deserve protection, support, and immediate training so they can stay safe on the job and have their needs met at home as well. From a workforce development perspective, as part of the economic recovery, California policymakers can also invest in equitable education and training pathways and support services that reflect the full needs and career aspirations of all Californians, including incumbent frontline workers. So looking forward to hearing more from the videos.
Thanks, Brooke, for that information. And for the people who are tuned in today, I know that between the videos and the conversation, there's a lot of information being shared. So we definitely encourage you all to continue to share your questions, your thoughts, and your reactions. What resonates with you? What's missing? We would love to hear from you all as we continue to engage in this conversation, and we'll be sure to address those towards the end during our Q&A. And so as Brooke mentioned in her comments, and as we transition into our next video, one of the most hard-hit industries during this pandemic has been the restaurant industry, especially those that are family-ran. These restaurants, unfortunately, are unable to stay open like our larger chain restaurants, and they are either forced to lay off their workers, as Brooke mentioned, or close their business, or both. So here, Maria, a community organizer at Rock the Bay, shares a bit more about how the impact of the pandemic has impacted the restaurant industry and its frontline workers.
Hello, my name is Maria Moreno. I'm a community organizer and program coordinator for the Restaurant Opportunity Centers of the Bay. We're part of a national organization that's called the Restaurant Opportunity Centers United, that focuses on policy advocacy and workforce development for restaurant workers around the country. We do specific outreach for folks of color and marginalized communities, the formerly incarcerated. When I wear my organizer hat, I bring different resources to the community, be it resources for folks who work in the industry and want to advocate for themselves in their workplace, whether they want to organize, whether they want to advocate for better protections. We do work with local coalitions to do policy pushes that affect restaurant workers, and we bring in restaurant workers to advocate for themselves and be at the table with us, with council members, senators, governors, you name it. Our industry has been one of the hardest hit. in this COVID crisis. Many restaurants either completely closed their doors, either permanently or temporarily, which meant massive layoffs for the majority of our industry. I've spoken to some workers that they used to have 40 hours a week and now have down to like 3 to 8 to 15 hours a week, if that. And many workers who are still have their jobs in to-go places often don't have access to protective gear, aren't really able to take paid sick time, even if they have availability to it. They kind of have to choose between, making what they can make right now in terms of wages or taking care of themselves. Our organization has set up relief funds for undocumented workers. We have done a ton of advocacy and policy work to get people emergency paid sick time to ensure that our workers are going to be guaranteed their jobs back when this crisis settles. However, they're already in crisis. They're already not able to make ends meet. They're already behind on their rent. They're already behind on groceries. They're already behind on all their bills. As an organization, we've set up a relief fund that within 6 or 7 days got 10,000 applications, and we had to immediately close for submissions because we're still sorting through those applications today. If we've learned anything from this crisis, is that resources didn't exist at the level that an industry of this magnitude deserves. There are over 13 million restaurant workers in the country. They don't have access to paid sick leave as a mandatory policy. They don't really have safety nets right now. Many of our workers have more than one job in this industry, and there have been some hiccups with that too, with unemployment insurance and being able to declare more than one job. I believe it's not possible through unemployment insurance, or it's difficult. We need not just emergency policies for our workers, we need permanent change. We need paid sick leave for everyone. We need the right to return for our workers for the jobs that will exist after this crisis is settled. Our workers are growing desperate, our workers are growing hungry, and our workers are severely struggling. I just want to drive this home that if there's anything that we've learned is that this is a very vulnerable industry. It was before COVID, and this has just exacerbated its vulnerability. We need stronger protections for our workers. We need stability for our workers. We need this to be considered the career that it actually is for many, many people, millions of people nationally. I just ask that please don't forget that restaurant work drives so much of our economy, and that so many people are working in this industry. So many different types of people, so many people from so many different vulnerable communities, from so many marginalized communities. Do not forget our workers.
Thank you, Maria, for those powerful testimonies and anecdotes from your clients. Based on the information you all shared while registering for this event, this harsh new reality is not exclusive to Maria, Rock the Bay, and even the restaurant industry. It's felt across the hotel and hospitality industry. It's felt across aviation and our flight crews. It's felt in public sector jobs and a host of many others. So I just want to acknowledge that. I also want to reiterate Maria's point about supporting the immigrant and undocumented population. Those populations, in addition to the Latinx, the Black, and formerly incarcerated populations, women of color, are among the most vulnerable during this pandemic and are experiencing compounded and now exacerbated inequities. In fact, many of you have probably read some of the polling from Strata Education, where it's been found that Latino Americans are most likely to have lost income along with reduced hours of shifts during this pandemic. This was something that Maria mentioned in her video. And that Black Americans are most likely to be laid off as a result of the pandemic. So considering this information and considering what we're seeing, I want to shift now to Zima. So Zima, in your opinion, how do we center equity during our recovery and restructuring efforts from COVID-19?
Thanks, Devin. First we have to recognize the reality that a lot of workers that are exposing themselves to the virus for a paycheck. And a lot of those workers are from diverse communities and are in low income positions. We need to ensure that this response and recovery efforts intentionally include diverse workers, including people of color, immigrants, refugee communities, women, LGBTQ community, and also geographic diversity. People that represent these communities have to be a part of the leadership team to work to address these issues. And we have to do this in partnership with the employers for it to work. We also need to support people that are working to upskill and earn credentials right now and in the recovery. So people don't fall off, after they've done so much work. California community colleges are delivering remote education and training, including health and public safety education and training. And we need these professionals to meet the pandemic challenges and to recover. Students, colleges, training providers will all need support in the coming years to recover. And if that's not provided, skills and equities gaps will grow.
Thanks for that, Zima. In addition to what you just mentioned, I also want to acknowledge organizations such as the Black Worker Center, Policy Link, the Center for Employment Opportunities, ARC, the California Immigration Policy Center, and a host of organizations that are featured today who are doing great work and amazing work to ensure that most of our vulnerable populations are safe and protected, especially during this pandemic. In regards to the undocumented community, we also want to commend Governor Newsom on his recent announcement of $125 million to fund and support undocumented immigrants to California. And now as we think about our next speaker and transition to our next speaker, you'll hear from Corinne Eldridge at the California Long-Term Education Center to hear how her organization is keeping an eye towards equity, especially as it relates to women and bridging the digital divide in the healthcare sector.
Hi, my name is Corinne Eldridge, and I lead the California Long-Term Care Education Center. We were founded in 2000 by the workers of what are now SEIU Local 2015. Our mission is to build the workforce of highly trained caregivers that Californians can't live without. CLTCEC serves two specific groups of workers: IHSS caregivers in Los Angeles and Alameda counties, and skilled nursing facility workers in skilled nursing facilities across the state of California. Our workers are everyday heroes, and they're on the front lines of this crisis. They're concerned for their own well-being and that of the consumers and residents that they care for every day, yet most continue to get up every day and go to work, providing crucial services for seniors and those with disabilities. We train around 1,000 home care workers in a variety of skills, but there are over 500,000 caregivers in this state, and the vast majority of them receive no training on standard precautions and infection control. We do support our students through education. In one of our modules for home care workers that we recently covered, we go over infection prevention, the simple lessons on proper hygiene, proper hand washing, and how different agents of germs are spread is extremely effective and helpful. There's been a caregiver crisis in home care and nursing home facilities for the last several years. It's demanding work at low pay that requires passion and love to do. COVID-19 is certainly exacerbating this crisis. We're working with SEIU Local 2015 to come up with innovative ways to recruit new people into the jobs and fast-track a quality online training program for those with limited digital proficiency. For nursing home workers, we're offering mobile classes on topics such as improving hand hygiene in the healthcare setting, COVID-19, the importance of infection controls to prevent the spread, and also stress management to prevent staff burnout, which is extremely helpful in this time. COVID-19 accelerated our distance learning plan. Our home care and nursing home teams quickly shifted our recruitment, enrollment, and instruction models to utilize a handful of solutions that meet our students' needs. This shows up in a variety of ways, including developing tutorials in multiple languages on how to use Zoom, registering and taking online continuing education courses, and food handler classes, utilizing simple and interactive ways to keep students online, and much more. Understandably, many of our students had a lot of apprehension about online learning because of anxiety related to using technological devices. Through tutorials administered through several different means, as well as personal and group sessions, we've been able to see our students succeed in a variety of different ways, and their comfort of utilizing technology and being online has grown. That's been really exciting to see. Learning still needs to happen in meaningful ways that adapts to the students' needs, be they linguistic, cultural, or technology dependent. And CPR, it can't be taught virtually. Many home care workers and nursing home workers are low-income women of color who are fluent in languages other than English. They don't have the luxury to not go to work because most live paycheck to paycheck. Nursing home workers are also exempt from the FFCRA, the federal leave law, so they won't get additional paid sick leave if they or someone they love tests positive for COVID-19. These inequities can be mitigated by treating nursing home and home care workers like the critical parts of the healthcare team that they are. Additionally, there are many people in this group that do not have access to technological devices or the knowledge on how to use them. This definitely is a factor that we had to consider when standing up an immediate solution in our response to COVID-19. But this allows us to be creative in finding solutions that work. We need policymakers to work on the supply chain issue and bring in PPE, advance training standards for IHSS caregivers, implement hazard pay for nursing home workers, and really reimagine the value that these workers bring to the healthcare system in caring for and keeping people safe and healthy in their homes. If IHSS caregivers didn't exist, many more seniors and people with disabilities would be in institutional settings where there would be more vulnerability to COVID-19.
Thank you for sharing those insights, Corinne. And a special thank you for the frontline workers in the healthcare industry who continue to fight against the spread of COVID-19 and are really out there putting their lives on the line. So we really want to extend our great gratitude and thank you for the fight against this pandemic. So one thing I want to mention in regards to Corinne's video is that she does a good job on touching on equity issues such as gender, such as pay, and bridging the digital divide. And she also addresses approaches that can be considered as organizations continue to think through how to deliver their services to their clients. And so I'm going to turn to Brooke here, and also the folks in our chat feature and online. I want you all to kind of share some innovations that you all considered. So looking to Brooke here, what innovations have you seen COVID-19 accelerating, either with industries or program delivery?
Thanks, Devin. As I think we've heard from Corinne and some of the other folks who weighed in on their comments, we're hearing a lot about steps that training providers and organizations are taking to move their training programs online to new digital platforms due to stay-at-home orders and social distancing. We're also hearing about steps that training providers are taking to provide short-term, immediately available training, which is necessary to respond to industry needs that are shifting regularly. A final point I would make is that we're hearing about how workers are going to trusted organizations, nonprofit job training programs, community-based organizations, and worker centers to get information and assistance, both about job training opportunities, but also about safety net assistance. With all of these efforts, they're all absolutely critical, but it's important to point out that individual programs and organizations can't go it alone. So we need public policies to support and scale these solutions and to make sure that the solutions are equitable. And that's why one of the things we're calling on policymakers to do is to invest in digital learning and literacy, as well as high quality short-term upskilling and reskilling that can address workers' immediate needs while also supporting their careers. We know that students and workers don't just need access to new modes of digital learning, though. We know that students and workers also need access to affordable internet and appropriate devices. And we know that students and workers need to be able to access training and new training platforms, including online training platforms with the support of organizations that they trust and from organizations that are equipped to provide culturally and linguistically competent services. So to make sure that these new modes of learning are accessible, it will be important for California policymakers to think about the support that's necessary when it comes to broadband, internet access, and devices, but also to think about how they can invest in an infrastructure of community-based organizations that can work in partnership with other critical stakeholders in the workforce development system and employers to deliver and support high-quality training during the crisis and throughout the recovery.
Thanks for that, Brooke. And I'm sure that you all can agree that COVID-19 has forced us all to reimagine how and where we work. So again, I want to direct you all's attention to the chat feature to share how you all have been adjusting, what has worked, what hasn't, and share those insights with our colleagues across the state. We want to make sure that you all are sharing some best practices around that. And going back to the point here, some of us don't have the luxury of working remotely. I know that there's been an uptick in the usage of Zoom and other video conferencing platforms, and also want to acknowledge that there has been a greater urgency to stay connected to the communities in which we work. And as we transition to our next video, we'll be highlighting and sharing our partner Lisa at JBS San Francisco, who's going to share some insights around strategies that her organization has deployed both internally with her staff and externally with some of her clients.
My name is Lisa Countryman-Quiros, and I am the CEO of JVS in San Francisco. For over 45 years, JVS has been serving the Bay Area community by connecting people with high-quality employment and good jobs. As it has been for all of you, this has been really a difficult time for JVS. While our staff have been incredibly resilient and positive and stayed present and open for our clients, at the same time, many of them are dealing with significant emotional burdens and trauma. Folks are trying to navigate continuing to do their job, to do a good job, to feel that they're doing a good job, but also meeting the increasing needs of their families and loved ones. And a persistent concern for staff is the deep and urgent needs of our clients. And this runs the gamut from food insecurity, which we're seeing significantly across our client populations, housing instability, the broader rise in domestic violence and substance use and abuse. All of these were present in the lives of many of our clients, and now the situation has certainly exacerbated all of them. We know that there is a significant surge in demand for job training, job placement, employment services of all kinds. Right now, we are seeing that our clients are signing up for virtual events in numbers much greater than they would have been for in-person events. We also had our first kind of rapid reemployment hiring event with USPS, so the Postal Service. It was filled within the first 10 minutes. So that was also fairly unprecedented for us. And again, another sign that there is a great hunger for services. We launched a very robust and holistic client survey. We did see that over 90% of respondents said that they were interested in participating in remote services and remote training. JVS is taking multiple approaches to how we are going to address this challenge. First and foremost, we need to make sure that people who are not already our clients know that JVS exists and that we're open for business, and they need to know the kinds of services and supports that we are providing. We know that we need to meet urgent needs. Our long-term goal is to help people achieve stability, self-sufficiency, and ultimately prosperity. But in the short term, we know that people are worried about food, they're worried about their housing, they are worried about maintaining their internet connection and keeping their phone on. We are increasing access to emergency employment. So we will launch more rapid rehiring events with high quality employers like the Postal Service. And the fourth component is expanded training offerings. A piece of that is offering a variety of shorter term training programs around things like how do you job search in this situation. But we are also building out a series of workshops that are both connected to our sectors of focus, as well as shorter term trainings and workshops related to skills that we see are on the rise across sectors. And then the last and fifth component of our approach is to maintain our career pathways training programs. The sectors that we're most focused on include healthcare, skilled trades, and technology. Of course, we need to see, and I think everyone who's connected to National Skills Coalition will agree, that we need to see more and larger investments in skills training for sure, but also in things like large-scale infrastructure projects. This is absolutely the time to modernize our infrastructure. It creates good jobs, it improves the quality of life for everyone, and there can also be positive environmental impacts to those kinds of projects. So I think that's a win-win-win across the board. It's also clear that there are a lot of different funding streams that could be applied to this situation that are currently too narrow. This is a moment to loosen some of those restrictions. SNAP E&T cannot be used to pay for OJT. Now is a time to change that. In California, the Employment Training Panel, those dollars cannot be used to reimburse training for placements that happen in the large hospital systems, in nonprofit clinics, or for trainings that result in placements within the public sector. If those are areas where there's going to be a surge in demand, where high quality jobs will continue to exist, then we should loosen those restrictions and make those funds available in the ways that they're going to have the greatest impact. The longer people go without access to emergency supports, without the opportunity to find a new job, there's the increasing risk of hunger, homelessness, etc. And so I think it's really, really critical that we take action as quickly as possible. Lastly, I think this event has exposed the huge risks that exist to our whole society when we strip away the safety net and pretend that it's not necessary. Now is the time to rebuild that safety net. And I want to see that happen with a view towards rebuilding our society in a more equitable way, with bigger investments in education, training, and our whole healthcare system.
Thank you for that video, Lisa. It sounds like you and your team are leading some great work at JVS, and that you are also finding ways to connect your young people to career pathway opportunities, and also retraining and reemploying adults to be eligible for quality jobs. As we begin to shift from crisis to recovery, Lisa also offers a set of recommendations for policymakers to consider, such as creating a network for community-based organizations for referral, leveraging SNAP E&T dollars, and also looking at infrastructure for quality jobs. So for my next question, I want to turn to Zima again. How can California use industry-specific strategies to create an equitable and inclusive recovery?
Thanks, Devin. Well, we have to save and create good jobs in high demand industries and build equitable pathways to them. That didn't change. Cities, counties, school and college districts are likely to lay off a lot of people due to this. Public and nonprofit partners will have to step up and help. Public and nonprofit partners are going to need help to survive so that they can continue to serve their communities. And maintaining California's investment in education and workforce infrastructure is absolutely critical as we recover. Skills and equities gaps aren't new, but the pandemic really shined a light on these issues. And we have to take those bright spots and continue to raise that awareness to move forward to get rid of these barriers. Clear, collaborative, and systemic approaches to supporting employers, workers, communities are going to be absolutely essential if we're going to come out of this with an economy and a state that works for all Californians. California community colleges are the largest workforce and training provider in the state. And in the last recession, CTE programs at colleges were disproportionately cut. Even as we needed them, we needed to train more workers. And the most vulnerable workers and students really lost out. And we can't repeat those same mistakes. Partnerships across education, workforce development, labor, and employer groups will continue to be the key to creating pathways that are equitable and support regional economies.
Thanks for that, Zima. I think all that you offered is especially true. I think it's a perfect segue into our next video here, which will feature Luis Sandoval from Building Skills Partnerships. I feel in his video, as you all will see, he does a great job of reiterating some of the key points that we saw from our previous 5 speakers. And he also shares some insights on how California can begin to shift towards a just and equitable recovery. So I'm going to turn it over to Luis.
Good afternoon, my name is Luis Sandoval. I'm the Interim Executive Director to Building Skills Partnership. Building Skills Partnership is a statewide nonprofit based in California with 6 different training centers throughout the state of California. Our work focuses around workforce development, immigrant integration, and community advancement. Over the year, we serve approximately anywhere between 5,000 to 6,000 workers, and we provide the bulk of the training at the workplace. So this crisis is unprecedented. I think that we all are facing the challenges that are very real. One of the areas that we see is unemployment, food insecurity, housing insecurity. So how do we make sure that we provide resources to these workers? We're seeing massive layoffs, work reduction. In any of the areas that we work with, janitors and other property service workers have been impacted. It's our responsibility to also look and engage the industry and employers around how do we address the issues of training and worker protection? How do we make sure that we provide training for janitors and other property service workers, such as airport workers, to provide the cleaning solutions, but also make sure that these open spaces in which they work are properly cleaned and disinfected. One of the models that we're approaching, and we've been engaging with the industry through the Labor Management Committee that we have, is around creating an infectious disease certification. How do we make sure that they disinfect and clean these open spaces and make sure that they're protecting the public health of everyone? As we look at protecting workers and making sure that they're safe at the workplace, Building Skills Partnership has been working with employers, the industry, SEIU, USWW, to develop a plan and make sure that we really address the needs of workers from a training perspective, making sure that they have the training to go into these workplaces safe, protected, and make sure that we have the training to support that as well. It's important that we address this as an industry, but also develop the standard and set the standard for this industry. So collectively, we've been able to raise the floor and looking at how do we raise the floor so that this is the standard within the janitorial industry in terms of protection, in terms of training. So as we shift from crisis to recovery, I think it's important that we think about it, what a just recovery looks like. How do we make sure that workers are, all workers are recovering equitably, making sure that workers who are vulnerable are not left behind, making sure that undocumented workers, making sure that immigrant workers, workers with limited language proficiency are at the forefront of recovery efforts, making sure that incumbent workers are also part of this conversation. If we look at what happened during the 2008 recession years, many of these workers got left behind, particularly when we're looking at dollars that came in through the federal level. Many of these workers were just simply left behind. As we think about innovative ways to approach the recovery efforts, that we really highlight and we lift up these workers. At the same time, I think it's an opportunity to engage labor, it's an opportunity to engage employers around high road opportunities, around training. How do we make sure that we provide these training opportunities that really deal with industry level and sector-based needs? At the core of this is how do we make sure that as we recover and as we move from crisis to recovery, how do we make sure that workers that are coming into the workforce are in quality jobs? It's not just about jobs, which is what we saw in 2008, but how do we make sure that they're going into quality jobs? And I think this is an opportunity where labor and management can come together around training opportunities, providing training digitally, making sure that we address some of these issues that we're talking about around documented workers, but also industry and sector-based approaches. I want to thank the National Skills Coalition, California Edge, several funders like the Irvine Foundation, the San Francisco Foundation, Silicon Valley Community Foundation, and other foundations across the nation that have really stepped into this role about how do we create a response and how do we make sure that we get resources on the ground. We have often been working, in terms of the property service workers and janitors. Janitors have been in the shadows. They work late at night, often unseen. I think this is an opportunity to really look at janitors and make them visible again, making sure that they're not afraid, that they're valuable employees, that they're valuable workers. But I think also as a society, as policymakers, as community, we need to value that and make sure that we put our support and our efforts to make sure that we provide the support to these workers where they're at and where it's needed today.
Thank you, Louise. And I want to say another thank you to all of our speakers and panelists who are here today for their insights and taking the time out to, submit these videos in a time where everyone is, dedicating their time to actively respond to the urgent needs of today's new reality. So I definitely want to thank everyone who was engaged in producing this live broadcast. I want to now transition to our Q&A. We have a question here from Mark Edwards at JVS SoCal. How's it going, Mark? So Mark mentions that we did not get an American Recovery and Reinvestment Act until after the 2018 election. So it appears similar funding will not happen until 2021. Is that a fair assessment? Brooker, Zima, you want to take this one?
Sure, I can take this. I'm not sure about the timeline. What I can say is for folks who are interested in understanding stimulus bills that are happening at the federal level, National Skills Coalition has done analysis of the stimulus bills that have already passed. That is available on our COVID-19 response page at nationalskillscoalition.org. And we are closely watching conversations about future stimulus bills, including support for workforce development and post-secondary education investments. So please keep tuned to NSC on our social media channels and our website to hear more about federal stimulus activity.
Thanks for that, Brooke. And looking more closely in California, Zima, can you share any news on the California state budget?
Yes, just very high level, and I wish I had happier news. I will share that budget hearings did just start. They are having just a few people in the Capitol and inviting folks to tune in remotely. We crashed the Senate website the first try, but that's been all fixed. It's been working out okay. So it's good that the hearing started. It looks like the May revise and the process, the dates is going to be on track. I haven't heard anything saying that it wouldn't be. However, what will be brought forward is what is called a work plan. I believe I got that terminology right. It's a brass tacks, bare bones budget. It doesn't have a lot of the specificity that we saw in January. It's really what do we have to do to keep the government going, and then the legislators are going to have to come back and take a look after a couple of months. And so we're still waiting to hear exactly what that's going to look like. In the hearings, they have shared, this fiscal crisis that this has caused is not going to be done in a year. This is going to be a multi-year recovery. And, California, we do have our rainy day fund. I get a lot of questions about our rainy day fund, and that will help along with some of the money that's going to be drawn down by the federal government, but it's not going to be nearly enough. And with our rainy day fund, the way it's written, we can only take half out at a time in a fiscal year, so we don't get all of it. So, it's going to be challenging. We had a lot of hope in January's budget. This administration has been very friendly to our issues. Still, though, workforce issues continue to be at the forefront despite this pandemic. So EDGE and NSC will be continuing to work in collaboration to keep all of you informed as we move through the budget process.
Thank you, Dr. Zima. And I also want to let everyone know that for all the questions that were not addressed during today's broadcast, we'll be sure to address them via email in addition to this recording and the additional resources to everyone who registered for this event and everyone on our listserv. And so as we transition out, we mentioned earlier that workforce solutions should specifically reflect the economic needs and career aspirations of California's most vulnerable workers and historically marginalized residents. Right now, our elected officials, to Zima's point, have an opportunity to develop an inclusive economic recovery plan that creates a better and fairer economic future for all Californians so that everyone has what they need to thrive. And with that, we ask everyone on this broadcast to help encourage our governor and legislator to use every policy lever possible to immediately protect and support our workers, communities, and businesses by signing on to a letter of support. Our letter of support campaign outlines a set of COVID-19 principles and priorities that will guide California on an inclusive and equitable recovery. Our principles focuses on securing basic needs and protections for California's most vulnerable workers, saving and creating high demand industries and building equitable pathways to them, modernizing and democratizing career and technical education, and lastly, promoting collaboration, systems innovation, and transparency among public, private, and nonprofit stakeholders. Information on how you can join on to the Skills for California letter of support are on the screen and can be found on our website at www.skillsforca.org under the Get Involved and Take Action button. Thank you all for joining in on our live broadcast, and we hope everyone on this enjoys the rest of their day. Thank you again, and have a good one. Bye-bye.
Thank you.